Okay, the next segment in the literature review concerned the evidence-based practice and practice-based intervention and strategies. And there was a deal of discussion in the review about the distinction to be made between evidence-based practice, what it consists of, what practice-based evidence are. Children's behaviour only changes through the direct experiences provided by their social and physical environments. In terms of the social experiences, the evidence suggests that the strategies known to be effective in promoting children's learning and development include the following. Response contingent child learning. Children with disabilities make more progress when what they do produces rewarding or interesting consequences. Participatory child learning opportunities. Children with disabilities develop a sense of efficacy and mastery when they're actively involved in interactions with their social and non-social environment, rather than just passively responding to adult demands or requests. Interest-based child learning. Children with disabilities show more positive social emotional behaviour and make more developmental progress when given learning opportunities and experiences based on their own interests. Parent responsiveness to child behaviour. Parents' sensitivity and responsiveness to their infant or toddler's behaviour during the parent-child interactions are predictive of outcomes in children with intellectual and developmental disabilities. In fact, any caregiver's interaction with the kid, that's true. Everyday learning opportunities. The traditional clinical approach in which children were treated by specialists in clinical settings limits the opportunity the child has to practice the skills they need to develop, and cannot guarantee that the child will transfer these skills to everyday settings. Accordingly, this form of service is being replaced by a natural learning environments approach, in which specialists seek to identify and use natural learning opportunities that occur in the course of children's everyday home and community routines. These everyday activities invite or inhibit child learning, depending on the characteristics of the setting and the behaviour of the people in the setting, in those settings. So obviously we're seeking to create environments that invite children's learning. A central aim of early childhood intervention services is to promote the ability of families to provide their children with experiences and environments that will promote their children's learning. The strategies known to be effective in doing this include the relationship between professionals and parents. It's a key to effective practice. Family-centred practice. It's based upon a partnership between parents and professionals, with the parents making the final decisions about priorities and intervention strategies. Using effective help-giving practices. These involve 3 sets of skills: relational help-giving, participatory practices and technical competence. Relational help-giving, what does that mean? It means help-giver interpersonal skills and help-giver attitudes that enable helpers to become more competent. Participatory help-giving includes help receiver choice and action and help giver responsiveness. So you've got to have skills in transferring your knowledge to other people, and there are skills involved in setting that up, in providing people with choices. And technical competence. On top of those 2 things, you've got to know your stuff. You've got to have the knowledge, skills and competence of a professional, and be able to translate that into terms that other people can easily appreciate. The first 2 of those skills are primary or threshold factors that function in an all or nothing fashion. Without them, the technical competence counts for little. However, if the goal is to improve outcomes for children, it is not sufficient to just provide good relational support. One must also give the parents actual skills and strategies that will have a direct effect on their children's functioning and participation. Okay, we now turn to challenges. There's a lot more, I should say, in the literature review about the evidence. So that is a snapshot of key things that we've learned. We also looked at the evidence regarding a series of challenges faced by the early childhood intervention system, including early intervention, points of access and referral pathways, soft entry points, waiting lists, which children are served, how you determine eligibility, how you assess children, program fidelity, the use of evidence-based and practice-based evidence, the intensity of service, how frequently do you need to see people, funding levels, funding models, attracting and retaining a highly skilled workforce, service system fragmentation, accountability issues, gaps between professional lay knowledge and understanding, and building community awareness and acceptance of disability. So a whole range of issues where we looked at the evidence to find out what was in the literature that might guide us and that might guide the department in thinking about what reforms are needed. There's clearly not enough time now to go through all of those. Have a look at the discussion in the review. I'll have a look at a couple of them though. One of them concerns service system fragmentation. Early childhood intervention services are very much fragmented. They're provided by a mixture of government and non-government teams and agencies, with some local government also providing services. They're mostly provided by dedicated early childhood intervention services, but some are provided by agencies that have a wider eligibility brief, such as Community Child Health. Some agencies are standalone early childhood intervention services, while others are linked with other support programs. The services vary greatly in size, from large agencies with many staff and the resources to support them, to small agencies with limited resources. Some services cater for specific disabilities, while others cater for a range of disabilities. Most non-government service providers are from not-for-profit agencies, but there appears to be an increasing number of private practitioners and agencies providing services. The actual services provided to people from all these diverse agencies and sources varies considerably between agencies, depending upon their auspice, philosophy and knowledge of contemporary evidence and best practice. The actual practices also vary, with some services using a more medical model and others using a more family-centred and family-focused approach. The locus of service provision also varies greatly, with some being almost totally home-based, some totally centre-based and some school-based. Most work done by ECIS agencies and teams is family-focused, while inclusion support is provided separately and through services that have their own funding, such as kindergarten inclusion support services. Although ECIS obviously does provide some direct support to mainstream services. Service coordination practices vary greatly, with some services using a key worker model, some providing case management separately to service delivery through a family service coordinator, and some having no formal coordination method, providing services through multiple individual practitioners, each with different goals. The bulk of funding for ECIS provision comes from the state government, but the federal government funds other related initiatives, and some agencies augment their funding through fees, fundraising, charitable and corporate funds. Now, there's no direct evidence that such a fragmented system produces poorer results, nor could we conceive of an ethically responsible randomised trial that would lead to answering that question. However, there are a number of strong reasons for thinking that this degree of fragmentation is undesirable. Where more than one agency or service is involved, families are likely to find themselves in situations where they receive competing demands on their time or contradictory advice about intervention strategies. Where more than one service option is available, parents are likely to find it difficult to judge the respective merits of the options. For instance, is a school-based program better for a child than a combination of home-based and inclusion support in a mainstream early childhood program? Where for-profit services are involved, it is more difficult to ensure that they are providing services that are consistent with government policies and philosophies or with current early childhood intervention best practice. And where home-based and community-based services are funded and delivered separately, as they currently are, it makes it difficult to develop coherent plans and implement strategies consistently across the different environments that children experience. So there's the challenges faced by us from the point of view of fragmentation, and the ECIS reform will be looking at what needs to be done to reduce that. I'll just look at one other issue here, report on what the review had to say about funding models. How should funds be distributed or allocated? Should all families receive the same allocation? The current funding model for ECIS services in Victoria is a per capita allocation, which is due to be increased this year, and the money goes to the service agency in which the child is enrolled. There is no requirement or expectation that the agency gives each family exactly the same level of service, equivalent to the per capita funding. Instead, the agencies make decisions as to how the total money should be spent, giving more services to families with more complex needs and less to families with fewer needs.